Hello, this is clinical reflection number 12, the last and final clinicals. It was bittersweet on my last day, but it was also a really great feeling because I made a huge accomplishment to me, completing all the hours and just meeting new patients each and every day, learning new things every day on the med surg unit. It was a great opportunity. So the very last day, once again, it wasn't much going on. We did get a new admission, and this admission, he had to have surgery because he has benign prostatic hyperplasia, and he developed the symptoms of lower urinary tract symptoms. So he does have a history of diabetes, also a history of GERD, and a prostatectomy. That's when it's a procedure with the prostate. Sometimes if it's enlarged or if there's some type of maybe some stones present in the prostate, they have to remove that area. So that's what he came to the med surg unit for. He was post operation, so we had to just maintain Q4 vitals for him. He did have a CBI Foley in place, so our job was to just continuously watch the drainage. Once again, the drainage must be like a light pink color. That's what we'd like to see because it shows us that things are flowing properly. But if we see a dark red color, it could possibly indicate a clot is forming. So that's not what we want to see. Um, he was asleep for a long time, but he was alert in oriented times four. He did experience some pain. It was more so of intermittent pain, but that's kind of expected due to him getting out of his procedure. So we did want to just treat his pain a little bit with some pain medications, oxycodone or Tylenol and everything. He did have five sites of redness on his body. Um, so we wanted to just make sure there's no bony areas that's getting on the bed too long. So we did have to rotate him sometimes and turn him just to make sure that his skin stays intact. Um, it was very interesting watching the CBI. We did have to change the bag out because at first we got a 2 liter bag, but obviously that's not enough because the drainage fills up very quickly. So we had to continuously watch that and we had to get a 4 liter bag, which was much better. So we didn't have to keep going in the room disturbing him every 30 minutes to an hour. We also had a sign on the door that would let, the other nurses know, when they come in for the shift change. We had a sign on the door that indicates that they have a CBI. So we had the input and then the output of the drainage that we saw. So and that's also for the technicians if they were going in just to maybe get vital signs on this patient because he is Q4 or just answering their call lights. If they see that the bag is getting full or maybe needs to be drained, they can possibly mark it on the door for the nurses just to let us know, hey, this is the output that is it currently is, so that can just let us know how much output he's getting. Um, there should always be more output than input. Because say if we give him 3,000 milliliters of fluids in the CBI, and he brings out 3,000, that's good, but he should bring out a little more because that should indicate his urine. So in one sense, like in this case, he did receive 3,000 worth of fluids in the CBI, so he did create an output of 3,250, and that 250 was his urine. So that was a good indication to see. So the output, it should be larger than the input that they're taking in. Um, but for the rest of the patients, we had pretty much the same patients. It was pretty nice to see the same patients. They were very friendly. I let them know, it's my last day. They had some good words of encouragement, and we just said our goodbyes and everything. Once again, just providing that compassionate care for them. Hopefully, they get discharged soon. But yeah, it was a nice day. I learned a lot on the med surg floor. That is something that I would be interested in doing because from the looks of it, you get a little bit of everything. You see all types of diagnoses and all types of patients that come through, and also just looking at the teamwork that they do there, the bonding. It's very helpful. It really reminds you, no nurse is left behind. So that's the good thing about it as well. So I had a good clinical experience for my synthesis. I really enjoyed it and learned a lot. Thank you.